Hey guys, what's poppin'? I'm glad you decided to click on another video. You're watching the Nurse Life 242, and in today's video, we're talking about study tips, okay? Study tips for the Nursing Council back home in the Bahamas. Now, I just want to get this out there that I was not a straight A student, and I'm not ashamed to say that, okay? Because we started from the bottom, now we here. I was able to pass my Nursing Council exam. I was able to pass my NCLEX exam, and like I said, I'm now here. Okay, so if I did it, you can definitely do it too. The Nursing Council exam is our national nursing exam that we take after you would have gone through your whole nursing school journey. This is the last thing that you have to do. You have to pass this in order to get your nursing license, okay? Obviously, you want to get your nursing license. That's why you went to nursing school. That's why you're watching this video, because you want to know how you can study. The Nursing Council exam, like I said, is your national exam that you take in order to get your license. And the way that it's laid out, it's not like the NCLEX, which is all multiple choice. Of course, I can't say too much about it, but it is really where they want to know how well you manage different diseases. So with the NCLEX, just to compare a little bit, it's all about, or a lot about, managing, your patient, managing your staff, because that's also important. But with, the Nursing Council, they want to know how well you can manage different diseases, different disorders, okay, different patients. The exam is divided into different categories, so you're gonna have different papers, like different days, okay? So you may have like a maternity and pediatric paper together, and then they may give you like eye and, I don't know, like a surgical topic or something to discuss basically. And so the way that it's laid out, they give you a disease, okay? They wanna know how well you're gonna manage it. If they give you a patient, right, a baby, let's just say pediatric paper, and they give you the topic on jaundice, okay? So that's a common one. And I think they try and rotate the diseases, rotate the papers, whatever. But anyway, jaundice, for example, okay? Because that's a common disorder. So you want to make sure that you know, first of all, make sure that you know the most common disorders that we see in the Bahamas. I would not even say just common around the world, common to what we see here in the Bahamas. So when you're on the board for different classes, I would say to just be mindful and maybe take a notebook, which you should have anyhow on the ward with you. Take your notebook and write down like different disorders that you find to be common, or ask the nurses, hey, what are some common diseases that you usually see in this, population of patients, whether it's pediatric or adults. Based off of what they tell you and based off of what you see, the kind of patients that you have, don't just focus on your patient for that day, but try and, nurse different patients so you can get a feel of different disorders, and jot them down. Jot down those diseases, okay? Jot down maybe some of the medications or the classification of medications that they give to manage that disorder. Once they give you this disorder, for example, if it's jaundice, they're going to want to know that you know what that is. So they may ask you for a meaning. So they break down the question into different parts. They may ask you for the meaning or the definition of this word, or what is this disorder, okay? So you have to explain, obviously, what is jaundice, okay? After you've done that, they want to know, okay, you know what it is. So now they want to know what are some signs and symptoms you may see in a patient that has jaundice. So the most obvious is the yellowing of the skin, the yellowing of the eyes, and then maybe like the lab work that would reflect that the patient has jaundice. Okay, so what it is and your signs and symptoms, okay, your clinical manifestations. And then they want to know, how are you going to manage this disease? The patient has these signs and symptoms. What interventions are you going to implement in order to make the patient better, basically? Because that's the whole point of nursing, right? Along with you and the doctor, what are some things that can be implemented? Of course, we know that in some situations, we have to wait on doctor's orders, but I think the main thing that they want to know is, how are you as a nurse going to, intervene? Okay, what are some things that you would do to manage without, doctor's orders? Okay, even pain is an easy one too. So, of course, we're going to give analgesics or pain medications under doctor's orders. So that can be an intervention. Just say, give analgesics as ordered by doctor. Okay, but before you get to that, what are some non-pharmacological things that you can do? Simple things like creating a quiet and relaxing environment. Okay, rating the patient's pain. You want to know, how bad is the pain? Okay, you want to know what else that you can do to alleviate the patient's pain. So if it's a massage that you may have to do, if it's, I don't know, maybe an ice pack or repositioning the patient or something, like, what are some things that you can do to relieve the patient's pain? And then you always want to reassess. So y'all remember those care plans we had to do? You always want to go back after you've made them interventions and reassess the patient's pain, whether it went down, whether it's the same, it may have increased. You want to evaluate, okay? Because obviously we have goals. The goal in this case is for the patient's pain to be decreased. Y'all got me feeling like I teach it here. I feel like I could be a little lecturer, a little professor. Well, anyhow, so what we did, we got in groups or pairs and, we studied. How it is now, I noticed that the clinical rotations sort of come down very close, like giving you just a little bit of time to study for your exam. And so I believe I may have studied in like that 2 to 3 week period. Don't be like me, start early. But that's what I did. And what you want to do is study in systems. So, you have the neurological system, you have the cardiovascular system, the respiratory system, the gastrointestinal system. You have all these different systems. So if you study by system and study like the common disorders that come under each system, I think that'll be an easier way to study. And then once you get to each disorder, you need to know definitions, signs and symptoms, management, and basically that's it. I don't know, I can't remember if you're required to like list the interventions or if you have to actually like explain, maybe in like an essay form, what you're gonna do, why you're doing it. And yeah, for the most part, I think that is like the structure of the paper, if they haven't changed it by now, because I've finished school, don't mind me looking young. I finished school about almost 10 years now. And that's college, not high school. Doesn't even feel so, saying that makes me feel old. But yeah, I've taken that exam like about almost 9 years ago. So I don't think anything has changed, but that was the structure. And we were able to get past papers too, just to see like the structure of the exam and stuff like that. So maybe you can do it too. Ask your lecturer, ask somebody. Ask somebody that would have taken it more recently than I would have. Let me say that. So that's basically the breakdown of the Nursing Council exam and, how myself and my peers would have studied. We had this big binder of notes with each like just common disorders, and like I said, we studied in that format and we were successful. Those that may not have been successful, they were able to take those particular papers over, because you don't just fail everything. You may fail, like, let's say, one paper. So they give you the opportunity to take that one paper over. I don't know how many times you have to take it. I assume maybe just once after that initial time. But yep, that's how it is. I don't think it's too hard. It's just that obviously you don't know what they're going to put on the exam, so you have to study everything. You may not be all the way to the end yet where you're ready to take that nursing council exam, but you're just trying to maneuver through nursing school. In terms of studying tip, watch those videos. I won't say that I didn't know about YouTube at the time, but I didn't utilize YouTube when I was in school. But I'm pretty sure if you do that now, you would be good to go and good with studying and making notes and stuff like that. Apart from those thick textbooks, it's much easier to watch a video. If you've made it this far to the video, I thank you for watching. Like I said, I hope it was informative, and definitely don't forget to give the video a thumbs up. Don't forget to comment down below, and definitely don't forget to subscribe to the channel if you haven't already.